This lecture covers the muscular pathology from Chapter 7. So myopathy is a general term for muscle disease. A strain is a tear or injury to the muscle or tendon, usually caused by overstretching. It can range from a slight overstretch, which is what we refer to as a pulled muscle, to a complete rupture. Early treatment includes rest, ice, compression, and elevation. That's probably sufficient for a pulled muscle, but for a complete rupture, the patient often needs surgery. Tendinosis is a degenerative disease leading to breakdown and scarring of tendons, likely due to the tendons not repairing themselves once they are injured. Symptoms of this disease include pain, tenderness, and stiffness at the affected site. The pain typically appears only when the disease is quite advanced. Risk factors for tendinosis include older age, occupation, and systemic disease such as rheumatoid arthritis or diabetes. Fibromyalgia refers to chronic pain characterized by at least 3 months duration. The pain must be bilateral and the patient must exhibit tenderness in specific points. They also have fatigue, disordered sleep, depression, anxiety, and exercise intolerance. No inflammation is involved in this disease process. It may be caused by hyperactive stress response. The treatment for fibromyalgia includes antidepressants, anti-seizure medications, exercise, and NSAIDs such as ibuprofen. This condition affects women more than it affects men. Duchenne muscular dystrophy is an incurable genetic myopathy, and it is the most common childhood form of muscular dystrophy. It affects males more than females because it is an X-linked disease. So a female will inherit an X from mom and an X from dad. And if the genetic variant is on one X but not the other, then the female will not exhibit muscular dystrophy. However, males only inherit one X from their mom and one Y from their dad. And so if they have the gene on their X chromosome, it will be expressed and they will suffer from Duchenne muscular dystrophy. Muscle weakness leads to muscular scarring, which leads to replacement of muscle with fatty tissue. This disease is progressive. Most boys are diagnosed at age 4 and are wheelchair-bound by age 10. The average lifespan for someone with muscular dystrophy is 17 years. The diagnosis is made through electromyogram or EMG. This is a test where a neurologist places electrodes in the proximal portion of the muscle and the distal portion and sends electric stimulation between the two leads and can tell how well the muscle is contracting. There's no definitive treatment for Duchenne muscular dystrophy, and patients should avoid physical therapy because it increases the breakdown of muscle fibers. Myasthenia gravis is an autoimmune disorder in which the body attacks the acetylcholine receptors of the neuromuscular junction. So therefore, muscle cells cannot respond to the stimulation from the nerve. Eye muscles are often first affected. The patient will have something called ptosis, where one eyelid hangs lower than the other. Most common in women over 40 and men over 50. You can make the diagnosis with an acetylcholine receptor antibody in the blood and with the electromyogram. Treatments include medications which increase the amount of acetylcholine in the neuromuscular junction, steroids, immunosuppressants, and plasma exchange. Tetanus is a muscular disorder characterized by constant and unrelenting muscle spasm. It is caused by a toxin released by the bacterium Clostridium tetani, which is caused by a wound contaminated by contaminated soil. So the soil contains this Clostridium bacteria, which then releases a toxin. It is not caused by rusty nails, which we previously had thought. Symptoms include a locked jaw, muscle spasms, rigid paralysis, stiffness, and pain. These symptoms can be brought on by very little stimulus, including loud noises or even turning on the lights. Symptoms are progressive, and they lead to the paralysis of the diaphragm, causing the patient to not be able to breathe. Vaccination is highly effective against this condition.